What is elephantiasis? It is commonly known as lymphatic filariasis, where it is a very rare condition that's spread by mosquitoes. The condition characterized by gross enlargement of an area of the body, especially the limbs, and may also affect the male and female external genital organs. This disease causing extremely painful, and it is also lead to severe disability and social stigma for the affected individual. This population is common in tropical and subtropical areas of the world, including Africa and South Asia. In 2019, it is estimated 120 million people have elephantiasis. Anyone can get this disease since the intensity of infection was not gender and age dependent.
I will proceed with causes and symptoms of elephantiasis. What are the causes of elephantiasis? Elephantiasis is caused by parasitic worms that are spread by mosquitoes. People with elephantiasis can observe that their skin will get thicker and harder. It will resemble an elephant's skin. I guess that's the way they get the name of elephantiasis. As I mentioned earlier, it is caused by worms. There are 3 types of worms involved, which are Brugia malai, Wuchereria bancrofti, and Brugia timori. So I prepare a table here to differentiate these 3 types of worms. Firstly, I will explain about the vectors. For Brugia timori, it uses Anopheles as a vector. For Brugia malai, it has 2 different vectors. Vectors 1 are Aedes, Anopheles, and Mensonia. Vector 2 is Coquilitidia, while for Wuchereria bancrofti are Aedes, Anopheles, and Culex. Secondly, they have a different microfilarial morphology. For Brugia timori, sheath is present and 2 nuclei at the tip. For Brugia malai, sheath is present but 2 nuclei in tail. Meanwhile, for Wuchereria bancrofti, sheath is present and no nuclei to tail tip. These 3 worms have a similarity in macrofilarial periodicity, which is nocturnal, but for Brugia malai is slightly different because they also have subperiodic. How about the symptoms of elephantiasis? Symptoms can be divided into 3 classes. First and foremost is asymptomatic. Asymptomatic means patients will have a hidden damage to the lymphatic system and their kidneys. That means their symptoms cannot be detected externally. Second is acute symptoms, which are attacks of filarial fever. In the other words, pain and inflammation of lymph nodes and ducts, often accompanied by fever, nausea, and vomiting. Therefore, this disease also has chronic symptoms. Elephantiasis causes swelling of the scrotum, especially in males, and enlarged breasts in females. For example, people with elephantiasis will experience swelling of body parts, such as legs, genitals, breasts, and their arms. We also can observe symptoms on sufferer's skin. They might have a dry and thickened skin, ulcerated skin, pitted skin, and even a darker skin than before. However, people may experience a fever and chills when they get this elephantiasis.
Enough exposure of the causes and symptoms of elephantiasis. I will continue to present about the mechanism of elephantiasis. Have you ever wondered what is the causative agent of elephantiasis? How the mosquito-borne filarial nematodes, especially Wuchereria bancrofti, causes the huge swelling on the human body? Let's dive into it. All human filarial nematodes have a complex life cycle that involves an insect vector, which is caused by mosquitoes that transmitted Wuchereria and Brugia. Their infection begins with the deposition of infective larvae, also known as L3, in the skin during mosquito bite. As you know, our skin consists of the epidermis, which is the upper layer of skin, and below it is the dermis of the skin that contain the blood vessel and lymph vessel. During the blood meal, the mouth of the mosquito, where resides the L3 larva, punctured through the dermis layer of the skin to reach the blood vessels. The larva enter through the puncture wound, which then reaching the lymphatics and migrate towards the lymph nodes. The larvae reside within the lymphatics and lymph nodes and undergo a process of molting, which is the 3rd molting and the 4th molting and development to form alpha larvae and the adult worms that outwardly resemble those of the Wuchereria bancrofti but are smaller. The adult worms will stay in the lymph vessel and can be whether female or male adult worms. Knowing that our blood vessel carry the RBCs and the blood plasma, it have little pores that allow the blood plasma to oozes out when the pressure increases in blood vessel and comes to tissue surrounding it. If the plasma then remains in the tissue, it can cause swelling. This is where the lymph vessel comes, as it have valves that allow it to open and take in the plasma and clear out from the tissue. Back to the adult worms, it stay in the lymph vessel, which then following the mating between female and male adult worms. The adult female then releases live progeny called microfilariae that travels in the bloodstream of human body. These microfilariae then will be ingested by mosquito during subsequent blood meal, where the microfilariae will undergo development in the thoracic muscle of mosquito to form L2 and finally become LT larva. To summarize, the swollen part of human body was caused by the adult Wuchereria bancrofti in lymph vessels. We know that the plasma or lymph that oozes out from the blood vessel will then accumulate in the tissue that results in dilation of the valve and the tissue got swollen with the lymph.
Is there any treatment for elephantiasis? Yes, of course there is a treatment for elephantiasis. People with an active infection of elephantiasis can treat it through medicine. Your doctor may prescribe to take a diethyl carbamazine, or we call it and known as DEC, combination with ivermectin. You may take the medicine once a year. It will help to kill the microscopic worms in your bloodstream. The combination for both medicine helps ensure in long-term result. However, not everyone who are having elephantiasis need medication. This is because the person may no longer carry worms in their body, but still having the presence of the symptoms of elephantiasis. There is also self-treatment that it can be done whenever you are having elephantiasis symptoms to ease them. First, you can wash and dry the swollen areas daily. Second, you may also keep swollen part elevated when lying down or seated. Third, you may apply moisturizer at swollen areas. Fourth, you may check for wounds and use medicated cream on any sore spots. And the last one, you may walking and exercise when possible. Sometimes, surgery is needed to treat elephantiasis. However, it is recommended for certain cases only. From the surgery, the doctor will remove the damage of lymphatic tissue. As a result, it will relieve pressure at the swollen areas.